In 2020, humanity faced a threat we never expected. A virus changed the world overnight, locking us down, tearing families apart, and bringing entire nations to a standstill. Then came the promise, a vaccine, a miracle of science, a fast-tracked solution to a global crisis. But 5 years later, the narrative is shifting. Countries are rolling back vaccine programs. Influential voices are questioning its use for children and pregnant women. And in the U.S., presidential candidate Robert F. Kennedy Jr. has vowed to put an end to it for good. This isn't about fear. This isn't about conspiracy. This is about evidence and asking the questions others won't. Welcome to Facts or Reality. Today we peel back the layers of the COVID vaccine, what it did, what it didn't, and what's really happening behind the headlines.
Some big changes now in the fight against COVID. The CDC is no longer recommending that healthy children and pregnant women get a COVID vaccine. You'll remember last week the FDA announced that it is limiting access to who can get that vaccine. Our SL resides live in our newsroom with more on what this means for everyone. Sal?
Yeah, Marie, Health and Human Services Secretary Robert F. Kennedy Jr. calling the latest move common sense and good science. Some health experts we've talked to are concerned and say the restrictions could have some significant public health impacts.
And I'm here today with NIH Director Dr. Jay Bhattacharya.
Here's the latest video posted on X today by Secretary Kennedy.
I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
Experts we talked to say the latest policy change will create a barrier between those who are not in these pre-specified groups and insurance companies, possibly deterring insurance providers from wanting to pay for something that is not required by the FDA or CDC. Last week, the FDA said it will continue approving COVID-19 vaccine updates for seniors and people with an underlying medical condition, including pregnancy and diabetes. The decision means many Americans without underlying conditions may not have access to updated shots this fall. Here's University of Illinois Chicago epidemiologist Dr. Katrine Wallace.
And in fact, the CDC has presented data that of children that are hospitalized for COVID-19, about 50% of those kids had no underlying condition putting them at risk for that hospitalization. So vaccination becomes important because it's not easy to risk profile children like it is with adults.
And as far as Chicago public schools are concerned, for the current school year, the COVID-19 vaccine is only recommended, not required for students. If the Illinois Department of Public Health issues guidelines following what the CDC is now saying, CPS will do the same. Coming up at 5, you'll hear why one pediatrician is recommending that parents still get their kids vaccinated. I'll have that. I'm live in the newsroom, SL Rezai, CBS News Chicago. Marie.
See you at 5 SL. Thank you.
Hi, everybody. I'm Robert F. Kennedy Jr.
U.S. Health and Human Services Secretary Robert F. Kennedy Jr. on Tuesday announced in a video posted on X that the CDC will no longer recommend routine COVID-19 vaccinations for healthy kids and pregnant women.
As of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
The CDC, following its panel of outside experts, had previously recommended updated COVID vaccines for everyone aged 6 months and older. But Kennedy, a longtime vaccine skeptic, said there wasn't enough, quote, clinical data to support the repeat booster strategy in children. Here's FDA Commissioner Marty Makary.
There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
According to the CDC's website, studies with hundreds of thousands of people around the world show that COVID vaccination before and during pregnancy is safe, effective, and beneficial to both the woman and baby. COVID vaccine makers Moderna and Pfizer did not immediately respond to requests for comment.
My name is Lex. I'm a nurse. I was a COVID ICU nurse, and I need to talk to you guys about the recent changes and recommendations from the CDC regarding the COVID vaccine underneath the guidance of RFK Jr. As of today, the CDC no longer recommends the COVID vaccine for pregnant people in the United States. This is underneath RFK's guidance. Mind you, RFK is not a medical professional and has no medical experience. I do. I was a COVID ICU nurse. I took care of hundreds of pregnant women that had COVID in the ICU. Do you want to know how many of those women survived? Let's not get into it. Now, the issue in this is the fact that without the CDC recommending that pregnant people get the COVID vaccine, that leaves insurance companies the option to not insure the vaccine to those populations. And insurance companies, if given the option to, are always going to do the wrong thing. Simply put, I watched so many pregnant women die. Pregnancy in itself is a hypercoagulatable state. COVID is a hypercoagulatable vascular virus. The amount of healthy pregnant women that I watched get life-altering or life-ending strokes, pulmonary embolisms, etc. If you worked in the COVID ICU, you know exactly what I'm talking about. Simply put, pregnant people are one of, if not the most vulnerable populations when it comes to COVID infections and the high risk for sentinel and fatal events. RFK Jr., until you have sat at the bedside with a healthy 28-year-old pregnant woman in her third trimester with her 2 young daughters at the bedside, trying to explain to them that mommy is never going to wake up and they probably will never meet their younger brother. COVID vaccine. Until you have had to ask for help loading a pregnant woman into a body bag because her, like 1,000 others, did not survive the hypercoagulable state that the pregnancy and the COVID virus created in her body, until you have had to use all of the strength left in your body after a 12-hour shift to maneuver that corpse into a body bag and then wheel that body bag. Now, pregnant people and people looking to become pregnant, please listen to me. Listen to your doctors. Listen to your doctors. If you are not pregnant now, get the booster before you get pregnant. Because I don't know what this means as far as insurance coverage for the vaccine for these populations. And I don't care what your political opinion is. I just want you to survive. I just want you to not be in the position that I watched so many women and so many families go.
The CDC announced today, Tuesday, May 27th, that they are no longer recommending COVID vaccines or COVID boosters for children or pregnant women as long as they are healthy. They said that many other countries have already started going this route because there's not a lot of studies that prove that, 1, it's necessary, and 2, that it is safe. Now, if you are 65 and older, you are still able to have access to the boosters and the COVID vaccinations, but otherwise they are going to make the qualifications much more stringent until they have more long-term studies. RFK Jr. stood alongside the director of the NIH and the director of the FDA, and together they made this decision and feel that it is best for the safety of the American population. They said this is one of the first steps in making sure that we make America healthy again. Now, what do you think of this decision? Do you support this? Do you think that children and pregnant women are good without the boosters and this experimental medical treatment? As always, let me know what you think about all of this down below.
It turns out the FDA knew about the myocarditis complication in young boys.
Swollen hearts.
Swollen hearts with now evidence that, say, roughly a third or more will have long-term scar tissue. That is what appears to be permanent. They knew about the myocarditis complication and did not make a public announcement or disclosure or warning about it until months after when they should have. So this is the sort of stuff that ruins public trust and hurts all of us who are physicians who need the trust of the public. So, you know, we're taking a lot of steps to try to rebuild that public trust, and one of those steps is to say show us the data. We're going to be evidence-based.
Well, the guidelines are in fact taking away the option to be getting a booster. You know, I think until now people have been opting, do they want to, do they not?
Yes.
Now if you're under 65, you may not be able to get an updated booster. So they, and also for people who are high risk, they will still have access. So if you are over 65, if you are high risk, so have an underlying medical condition, and they are including women who are pregnant or recently pregnant in that group, they would still have access to updated boosters on the basis of antibody data. But for people who are younger than that, they are requiring clinical trials that, quite frankly, because of how long it takes, how expensive they are, it's very unlikely that they would happen in time for an updated booster for those younger age groups.
So it sounds like that the FDA is taking a more evidence-based approach. Is that not true?
Yeah, I don't know.
Because there's pushback.
That looks skeptical.
There's a little double-speak going on.
Okay.
So normally what would happen here, at the very least, there would have been what we call a meta-analysis or systematic review where they take all of the data on all of the vaccines to use to date, all the information, summarize that. That was not done. So what you got here was a 2.5-page paper, which was really a policy opinion piece in the New England Journal of Medicine in a town hall meeting. Also, normally, when you have a big change like this at the FDA, this is done much more transparently, where it would be done publicly. You might remember, if you were a big nerd like me, you could watch these kinds of proceedings live on YouTube. All of the scientific slides were provided. None of this happened this time.
Bottom line, if you're under 65 and healthy, no COVID booster. That's
It's going to be, if you're healthy, you're unlikely to be getting access to a COVID booster.
We live in a time when trust is fragile, when institutions, governments, and even science itself are questioned like never before. And maybe that's not a bad thing. When it comes to the COVID vaccine, the truth isn't black and white. For millions, it brought peace of mind. For some, it brought side effects, confusion, even loss. Was it rushed? Possibly. Was it necessary? For many, yes. But were mistakes made along the way? Absolutely. Now we face the consequences, not just biological, but social. Divisions between vaxxed and unvaxxed, policy reversals, and the unsettling feeling that the full story still hasn't been told. When Robert F. Kennedy Jr. says he'll stop the vaccine for children and pregnant women, he's not just making a policy promise, he's tapping into a public skepticism that's been growing for years. So what's the reality? That's not for us to decide. Our job is to lay out the facts, with clarity, without fear, and with respect for every voice in this conversation. If you value truth over tribalism, if you're tired of censorship, spin, and silence, then stay with us. This is Facts or Reality.
This is Facts or Reality channel, where the truth will shock you. Please like, share, and subscribe, and also click on the notification button. Thank you.